I'm Jill Finkelstein, Regional Manager, Health Information at Broward Health Coral Springs. Today, we're here with Dr. Paul Isaacs from FTI Consulting to get a better understanding of the benefits ICD-10 has for physicians. Dr. Isaacs?
Thank you, Jill. My name is Dr. Paul Isaacs. I'm Senior Director of Health Solutions at FTI Consulting. And today I'm going to talk about some of the benefits of ICD-10-CM for physicians. ICD-10-CM was developed with extensive public clinical input, and as a matter of fact, much of the specificity included in ICD-10-CM were requested by physician groups and medical societies. Any future modifications to ICD-10-CM will be also addressed in a public process and will include requests for new codes coming from physicians. Some of the benefits of ICD-10-CM for physicians are a code that is updated with clinical knowledge and terminology that are current. It will also include fewer rejected improper reimbursement claims, decreased demand for submission and resubmission of medical record documentation, and also the increased specificity will provide better justification of medical necessity for treatment and diagnostic tests. Also, better data will support research and patient outcomes and safety studies. Some other benefits include better management of chronic diseases by capturing patient populations, more accurate reflection of the patient's clinical complexity and severity of illness, improve administrative efficiencies in lower costs, and what do I mean by that? Will be decreased demand for a submission of medical record documentation. There will be more accurate and fair reimbursement for the physicians, and there will be validation reported evaluation and management codes. And very importantly, less in misinterpretation by auditors, attorneys, and other third parties. Let me talk about some of the specific requests that were made by some of the specialist groups. There was a request for increased laterality. Matter of fact, it's a new feature in ICD-10-CM. It accounts for about 46% of the new diagnostic codes, and this will allow physicians to have the ability to now bill for codes to support medical necessity for the procedures that they bill for. The OBGYN physicians wanted to replace episode of care and change that for trimesters. The infectious disease professionals wanted requested a code for Ebola and other infectious diseases that are not found in ICD-9. And like ICD-9-CM, physicians will use a small subset of the codes specific to their specialty.
Dr. Isaacs, can you share some clinical examples of some of the advantages ICD-10 has for physicians?
Absolutely, Jill. Some examples that ICD-10 allows for better disease management. For example, let's use asthma. Intrinsic and extrinsic will be replaced by intermittent or persistent as the types, and mild or severe added to provide severity, allowing the physician to provide a more specific treatment plan, in essence providing better quality of care at a lower cost. ICD-10-CM offers opportunities for improved automated identification, stratification, and segmentation of patient populations. It will also allow for customization programs for patients with differences in severity of care or risk, much more of a patient-centered treatment plan. Additionally, ICD-10-CM codes capture reasons behind non-compliance, such as a lack of financial resources, so that the underlying issues can be addressed. Let's look at another example that is very common for physician practices today. Diabetes mellitus. In ICD-10-CM, diabetes mellitus will be classified by controlled versus uncontrolled. Rather, it will be classified as either type 1 or type 2, and increasing the coding granularity and providing much more detail about diabetic complications than ICD-9 codes by the use of more combination codes. ICD-10-CM specificity enhances the ability to more precisely track complications and outcomes associated with diabetes. There will be greater detail about complications of insulin pumps, for example, any breakdown, displacement, leakage, infection, or any inflammatory reactions that are associated with this new technology. There will be greater specificity, and ICD-10 codes can facilitate monitoring the effectiveness of diabetes, including specific reasons for unsuccessful diabetic management, such as a patient's noncompliance with dietary or medication regimen, or any other socioeconomic factors that impact the patient's role in effectively managing their diabetes.
Dr. Isaacs, can you share some of the free resources that are available to the physicians for ICD-10 training?
Sure. I would encourage all of my colleagues to check on these particular websites. They're free resources with tons of information, and some of the resources can be found on CMS. The road to ICD-10, the Small Physicians Practice route to ICD-10 link. AHIMA also has a lot of free resources for physician groups. AHIMA and all their local affiliates are offering free workshops for small physician groups and practices. And additionally, there is the ICD-10 Coalition that have abundant resources for the physician groups.
Thank you, Dr. Isaacs. Thank you for sharing some of the clinical advantages, the benefits, and some of the free resources out there for our physicians.
You're welcome, Joe.
Thank you.